Hello, I'm Brad Kain, CEO of Salus, and I'd like to welcome today Megan O'Brien to Voices of Experience. Megan and I have worked together for a while now, but I'd like to have her introduce herself, and we're going to talk about protection case management today.
Yeah, thank you so much for having me, Brad. I'm really excited to have an opportunity to talk with you and explain a little bit more about what I do and how Primero has supported those efforts. So, I'm Megan O'Brien. Hi, everybody. I'm the Senior Information Management Specialist at the Violence Prevention and Response Unit within the International Rescue Committee, or the IRC. I've been with the IRC for about 6 years now. I started as an intern and eventually was able to join as an employee. And my introduction to the IRC was through our information management systems specific to gender-based violence case management. And over time, my role has expanded to look at how we capture and utilize case management data across all of our case management streams, which includes gender-based violence, child protection, and now, as Brad mentioned, protection case management. Since I've been at the IRC, I've had an opportunity to work collaboratively across different agencies as a part of technical teams and steering committees, as well as the Primero Coordination Committee, which has been one of my favorite parts of work.
And for the people listening in that may not know this, let's just explain for a second that Primero is an open source digital public good that was originally developed for UNICEF. It's also a core part of what we provide at Salus. And so that technology is common amongst the work that Megan does around the world and a lot of the work that Salus does with its clients here in the US and Canada. But I think that's great background and great introduction, Megan. I really appreciate that. Let's start by just talking about basics. Like, what is protection case management? How does it differ from case management in general? And what would you say to someone that needs to understand the basics of how this fits in terms of the delivery of some social services or humanitarian services?
Yeah, so I think for me, the way that I understand protection case management, and it can look like a lot of different things, but in the humanitarian sector, there are three core case management streams. So you have case management for survivors of gender-based violence, which requires specialized services and training, and we have standardized data collection processes for that bucket of case management. You also have child protection case management, which serves children specifically that are survivors of violence or who need specialized services. And protection case management is kind of the bucket of case management that captures individuals who need psychosocial support or access to additional services who don't qualify for gender-based violence case management or child protection. So this can look like a lot of different things. It can look like individuals with disabilities who are experiencing barriers to accessing services, whether it's systemic barriers or prejudicial barriers. It can look like individuals who need help with legal documentation or land rights. So I think that that's the best way I would describe protection case management. And there's been a big push in the last couple of years to better support this stream of work as well. They just released the Global Protection Case Management Guidelines, which now allows access to standardized forms for data collection across different countries. It has standardized best practices. And over the past year, I worked with a team to develop a digital case management information management module hosted in Primero to support caseworkers and teams that are providing protection case management, which is a core component. You can't really have case management without documenting case management, which means information management is intrinsic to this process. And through the past project, this past year, we've now created a space where we can digitally capture that and analyze that information for safer data collection, for easier data processing, and to hopefully streamline case management work itself. That's kind of my ethos in this space is how can we make the jobs of the people providing direct services easier and safer? So yeah, that's a little bit about protection case management.
Would you describe it as an emerging specialty then within case management, protection case management, and one that is less bounded by age and gender than some of the other specialties? Is that accurate?
I would describe it as an emerging practice and specialty. I think GBV and CP case management have been well established, and those technical specialties are readily available across the humanitarian sector, where protection case management, I think, it's not new necessarily, but I do think it's growing. It is bound by age. I would say anyone under the age of 18 wouldn't qualify for protection case management, but it is less bound by sex and gender compared to gender-based violence as well. So there are parameters, and I think a core component of protection case management is identifying referral pathways. So whether that means stopping and referring to GBV or CP if that's the more appropriate case management path, but also connecting individuals with services that are relevant to their case and context. I hope that makes sense. Yeah.
No, absolutely, absolutely. And I think that all of your comments point back to something that we've understood in terms of our work with UNICEF, IRC, Save the Children, many other organizations, is how important it is to enable the caseworker with the right tools, the right workflow, the right processes, because it's not enough to give them a tool, whether that tool is a simple one or a more sophisticated tool. It's all about building their capacity with the right skills and approach and process. And sometimes that means terminology and an emerging specialty like protection case management to help inculcate what that process needs to be. So what do you see as the current gaps in how any kind of case management, maybe particularly protection case management, is supported and delivered in the field? What most worries you in terms of its implementation?
So I think I'll stick to my area of focus, which is the case management information management piece of what protection case management, or PCM. So one of the gaps that we have recognized for several years is the lack of a standardized tool for caseworkers to be able to use and supervisors to be able to use to support the case management process, which is what led to the development of the PCM IMS Plus. But without a standardized digital option, what we have seen over and over again is a reinventing of the wheel, which is costly. There's a lack of the ability to adhere to minimum standards for digital case management systems. And so without the development of a globally accessible tool, we can see unsafe practices happen. It can hinder the ability of case workers and supervisors to properly support individuals as well. And it also inhibits our ability to measure the impact of protection case management too. So that's been a big gap for a long time. And I think through the PCM IMS Plus, we've created an opportunity to address that gap. And so currently, we're rolling out the first instance of this, and I'm hoping through the learning of that, we'll be better equipped to promote the opportunities to address the gaps that I was talking about.
PC MIS Plus is the configuration of Primero that particularly supports protection case management in the field.
Yes, yeah. There's a lot of jargon that I use on a day-to-day basis, and it's hard to catch. So
we are all guilty of that, Megan. So
I know.
I'm just trying to just give some pointers here to everyone else.
Yeah.
This has been a big focus for what we've worked on together, over the last few years, and I think you're absolutely right, and it's one of the reasons why it's been such an important area in terms of our collaboration with UNICEF is to build that common tool set to enable the broader community of case managers to have that robust infrastructure and not be reinventing it, not be trying to do it in Excel, not be trying to do it in different gerrymandered applications, and being forced to learn the same lessons again and again.
And one thing I'll say too, because we did a lot of collaborative learning prior to the building of this module, and another piece, and I can talk more about the challenges around uptake, but something that I heard over and over again from caseworkers and teams directly was that they're familiar with Primero as a tool. And so the barrier to uptake is reduced by utilizing a system that not everyone necessarily, but that a lot of people are familiar with. I think it's a little bit easier. It reduces those barriers to entry. And the people that are providing these case management services are already overworked and under-resourced and are working in intense contexts, conflicts, in post-disaster settings and active disaster settings. So I think having something that's familiar as opposed to not just reinventing a system, but learning as an entirely new tool is also beneficial in this space.
And to have a tool that is very oriented towards the high caseload, the need to rapidly either take in information or update case plans or go through their day-to-day processes I think is really fundamentally important. It can lead to, when you first look at some of these applications, they look somewhat dull, but it's because they're designed for systems that are used 8, 10, 12 hours a day to support the caseworker in their engagement with their clients, right? Which is really the important aspect of technology here, is to enable them to do their job more effectively. You mentioned outcomes and measuring outcomes. Let's talk about that, because I think that's a really key area for thinking about implementation and then fitting whatever technology platform an organization uses to how it needs to work. What do you see as the important issues around key process indicators or how outcomes are measured?
Okay, I'm really excited to talk about this. So there's a chance I get too deep into the weeds and take us on a bit of a journey. So let me know.
It's all about
if
outcomes. It's all about
yeah,
outcomes.
if you need to reel me back in, let me know. But so I'm going to talk about outcomes specific to GBV case management first, and then I want to talk a little bit about the advocacy that we've been able to do with the recent funding cuts to our programming. Yeah, so these are our landing points that we'll get back to eventually. So one of the things that is really important when it comes to monitoring and evaluation and understanding case management processes is the measurement of outcomes. So across our case management streams, there's been a big focus to better understand the impact case management has had on survivors or children or clients. And through that, over the last several years, we've been able to develop several different measurement surveys or tools to look at different points in times for the people that we're working with to see how their sense of internalized felt stigma has changed or how their psychosocial well-being has improved or not. And we've been able to build these tools into our digital case management systems, into Primero, so we could easily calculate and look at these changes over time as a result of case management and use it for individual support. So not just looking at the broader program picture, but caseworkers can look at these outcomes measured in the system to inform their action planning or their case closure and better support individuals. I worked with a caseworker who told me through the outcome measurement in the system, they were identifying that there wasn't improvement over time, which led to additional questions that uncovered additional challenges the individual was facing. So they were able to refer them to more specialized services, which ultimately led to individual improvement. And I think that's really important. When we're talking about these broader systems, it's easy to lose sight of the individuals that this actually impacts. So caseworkers, survivors. And so I think that that's one part of outcome measurement that we can support that is really impactful. And then over time too, if you're looking at a broader data set of outcomes, you can better understand your programmatic quality and use that information to make changes to how support is being provided. It can provide insights into caseworker caseload and burnout as well if you're noticing trends in one way. And you can use that to work with your team as a part of your supervision to make broader adjustments that, again, can really have a large impact on the individuals who are seeking case management services. And then we've also been able, so we have this tiered use, right? So individual programmatic improvements and then broader advocacy. So to understand and be able to show that case management really does make a difference and that it is life-saving work has been huge in helping donors understand the importance of this work. It's easy to measure health impacts, nutrition impacts, but these broader psychosocial support ecosystems can be a little bit more abstract. So this outcome measurement through the system really gives us concrete grounding on what that looks like in practice. And one thing, this is something that I've been working on just the past couple of weeks, Brad, that's been really interesting as we've had emerging funding crises take place. We've been able to go into Primero and our instances that are utilizing Primero and pull relevant data quite quickly to compare Q1 of 2024 to Q1 of 2025 to identify exact points in time where we're seeing significant changes in our case management. And one data point, I do think that this is outcome impact, I would say outcome impact analysis that's been really, really insightful and important is the look at case closure reasons. So I've been able to go into 2024 and 2025 of our GBV case management programming case closure reasons and see the change. And I can say that there was a over 30,000% increase in cases closing because of funding cuts compared to 2024. So those drastic insights into our programming through quick and accessible case management data has been essential for understanding the broader implications of our programs and funding and advocacy efforts as well. So we've also been able to see beyond just the case closures, the change in people accessing case management. And there's been quick drop-offs that are quite clearly connected to funding cuts.
Two follow-up points, one around KPIs versus outcomes. I know we often conflate the two.
Yes.
KPIs are important, they're critical, they're how we measure whether an organization is being effective in terms of its process or not. And it can include case closure rates, time spent on cases, a range of process-oriented metrics on, the services being delivered. But it always seems to me that outcomes are the most elusive and yet the most important aspect here. They seem very context dependent, and we often depend on a sort of an amalgamation of, well, did we do good work, by capturing a psychosocial metric of some kind, right? Any thoughts on how to improve the attention on outcomes themselves and not just the process for getting to those outcomes?
Yeah, that's a good question, and also an important clarification. I think the way I like to think about outcomes is something you can count pretty easily, or not outcomes, I'm sorry, indicators is something you can count, where outcomes, like you said, is a little bit more elusive of a concept. And we've actually started to build outcome measurement into our framework of key indicators as a broader organization at IRC, which I think has been interesting, and I think is the trend that's happening across organizations. This is something that I worked very closely on over the past year and a half. And the project that I worked on to better understand how to interpret and incorporate outcome measurement involved a lot of learning and individual discussions. And one of the key barriers to being able to capture and utilize outcomes was really centered around how to build it into the case management process itself, and then also when to measure, because case management looks different for everyone, right? No one's going to, it's not linear. It can be different for everybody. So we've changed how and we define when to capture data, and instead align it with different parts of the case management process itself, as opposed to the number of sessions. So I think that clarification has been helpful. And also equipping caseworkers with the ability to ask questions in a way that flows into conversations with individuals instead of a survey that you sit down with and fill out. And I think that has made it feel more organic. And I'm hoping to see that implemented more and more as people become more familiar with these tools and as they're socialized further.
So capture the information along the way, as opposed to post facto survey, is going to make it feel more real and relevant for the people involved. I think that's absolutely right. We sometimes say, and this may be a technologist way of thinking about it, but you have to instrument the process to collect the right data.
Yeah, absolutely. And then one of the other things we worked about too was how to interpret the analysis of these outcomes, right? So we capture it, we have formulas for analyzing it, but what does it mean and what context do you need to understand what that means? So we've tried to standardize that as well to make it more accessible when it comes to the actual interpretation, which was an interesting learning process.
Megan, my other follow-up question for you mentioned the cut in U.S. AID funding and the effect that it's had on the international humanitarian space. It is a challenging time for any organization like IRC, but where do you think we go from here?
That's the big question, right? I've been thinking a lot about this, especially as I've been doing analysis on the impact of case management as a result of the program and funding cuts. And I think we have to go to a place of scrappy innovation is the best way I could define it. One of the things that we've been exploring at IRC is how we can collaborate more across our case management programs and integrate our solutions and tools to uphold all of that programming, not just within one sector. So for us, that looks like finding opportunities for joint instances or opportunities where we can create a digital case management system like Primero to promote the different modules of case management within one configuration. And that helps in terms of cost sharing, whether it's one program that might have more funding at the moment or it's shared across programs. But it really, I think, is one of the most, I think we have to move in that direction. And it also promotes better referral processes at the same time. So there's a lot of benefits. So this joint integrated case management program system, I think, is one way forward that we can address this. And I think that it's also, I think that there's a lot of benefits to that too. So when we're looking at digital case management IMS, I think that's a creative, scrappy way forward. We've looked at that at IRC at a single agency level, so just for IRC itself. But I'm hoping as an interagency body, we can look at that across agencies too. So I think that'll be an emerging study that we take forward. And then I think kind of what I talked about, utilizing this really impressive body of data that we have access to better understand the impact that both case management has and the impact that closures as a result of funding cuts have, and how we can partner that information to create a more holistic picture and communicate this across different government bodies, across donors, across agencies, so we can collaboratively work together. I think we have a really unique opportunity with the systems we work with to promote that kind of coordination.
I couldn't agree more. I think separate from the objective of continuing to advocate for humanitarian services, social services in general, and the value to the society that the funding does provide, there are people that need to advocate for that. But I think, I view my role and the role at Salus as providing the technology that enables organizations to build a better story with their data. And that better story can lead to a renewal in commitment, a renewal in funding, sort of revitalization. But we also owe it, in the face of this, exigent change to attitudes about funding, to be more productive and more effective. And I think technology can play a role in that, and some clear thinking about how to improve and optimize, what we do as a sector is totally valid. We may not have chosen to see, 20, 30, 40% cut in funding, but we have to respond to it. And you can respond in different ways through advocacy, but also through improving what we try to do. Any final thoughts that you might have for people listening in about the value of protection case management, or things that you would like to see happen over the next couple of years in terms of how practitioners approach PCM?
Yeah, I think when it comes to protection case management, we have seen over and over again the need for a digitized system, and also a want. The people who are providing this work really want to have access to a standardized digital system to support their work, to make it easier and safer. That's a big reason that we've been able to pilot the first rollout of PCM IMS Plus. And so knowing that, I think what I want people to consider as we move in that direction is maybe some of the challenges to uptake when it comes to this. I think it's worth addressing, because any sort of disruption to someone's work process is going to be met with tension or resistance. And especially when you're introducing a new technology. And some of the things that I've seen when it comes to supporting getting over that barrier of challenges to uptake are really providing spaces for the people who are using the system to come to you to troubleshoot and address the challenges that they face. So for me, that looks like ongoing weekly coaching at the start of these processes, and ensuring that there's an in-country focal point to really help promote and support on the ground. And so there's a lot of back work that needs to take place to support this transition. Even though it's really wanted and needed, we still have to consider the bumps along the way there. And with that too, when it comes to uptake, what I've seen over time, once you get through those barriers, is the opportunity for the system to really not just be appreciated and understood, but kind of help the teams flourish in different ways and create opportunities that they might not have seen, that we haven't even seen or considered through the familiarity and the use of the system. So yeah, I wanted to address that because I think that it's one of the biggest challenges for teams when it comes to wanting to actually move forward with the implementation of these systems. And we just see tons of benefits, but there are a few things we need to consider before we get to those parts.
One aspect of technology that's really come to the forefront of a lot of discussions over the last year in a way that I haven't seen, frankly, with other technologies, even over my career, is AI. Do you see a role for AI in protection case management, social services in general, the work that you've seen, or do you see or do you have some warning signs around how it might be used?
I think both, right? There's a lot of potential and a lot of risk when it comes to the use of AI with case management, with protection case management. And I think before any benefits take place, robust risk assessments need to happen, and a true understanding of what those dangers, what those risks could be. And then I think really creating AI in collaboration with people providing these services and the people on the ground, women and girls, the people who are displaced, having them be a part of the model building for AI is essential to ensure that it's going to be useful. But when I think about some of the opportunities with AI and protection case management, there's so much opportunity for AI to make work easier when it comes to one of the things that I've heard caseworkers and experts talk about is the potential to use AI for risk assessment understanding. So with protection case management, you need to work to identify the risks and then identify the risk level. And that's a human-centered process, but I think there's an opportunity to utilize AI, if done safely and in collaboration, to identify patterns of protection risks and risk levels and contextual analysis that might be harder for us as individuals or as humans to see. I think that bigger picture pattern identification, there's a lot of potential there. And even just when it comes to translation, I've seen that improve my work hugely. Just the ability to more accurately translate forms and communication with my colleagues whose English might not be their first language. That alone has just been a huge difference in how I've been able to work across contexts over the last 6 years. And then I think there's an opportunity, again, if done safely and in collaboration, for us to utilize AI to better identify resources, referral pathways, and even to potentially provide those to individuals through things like chatbots. So especially as we're considering funding cuts and programmatic closure cuts, is there an opportunity to utilize AI in the form of chatbots to get individuals who may no longer have access to direct case management services, to the referrals that they might have been able to seek, to resources, or to safe guidance or direction towards opportunities to support their psychosocial well-being? And I want to, with a big caveat of AI providing case management is not something that I would endorse. There has to be human connection and understanding of those broader context pieces to really provide safe and ethical protection case management to individuals. But yeah, there are a few applications. Yeah.
Right. Sorry. Yeah. But it is a broad context, and maybe there's ways that technology can play a role that better enables the time that you can have with face-to-face with a client.
Yeah. As we get creative with our solutions, I think it's something that we need to explore and better understand.
All right. But caution is probably not a bad way to move forward with any technology. So.
Oh, absolutely. Yeah. Yeah. I think people are quite excited about it, and there are things happening without the proper understanding of the risks in place.
Megan, I want to thank you very much for participating today. Greatly enjoyed our conversation, and I hope our viewers did too. And again, thank you.
Yeah, thanks so much for having me, Brad. It was a pleasure.